cannot believe this broke. All right. I had to turn it on because my my stand for my phone broke literally as I was putting it in. Hold on one second. I'm trying to fix it. Wait for it. It's really annoying me. Okay, let's see if it works. Hold on one second. Wait for it. Hold on. Okay. Boom. There we go. Y'all, this literally broke. Okay, hold on. All right, here we go. All right. Oh, I'm turning a fan or something. It's pretty hot. Your girl's in menopause, okay? It's pretty hot in here. All right, how we doing? Hey, boo, hey. Hey, boo, hey. Hey, boo, hey. All right, so let me look and see what y'all saying. Awesome. Yeah, you got your bottle study gummies. Awesome, awesome. Also, if y'all are on here, I don't even know how many we have left, to be honest, because people have just been buying them up. If you have not gotten a bottle of study gummies and you want one before we sell out, because if we restock, the next time we'll be able to restock and actually get them in, won't be till September. So if you want them now and don't have to wait till the end of the year, I suggest you get them now. It is app only. You have to download the Nurse Sam app to grab your wonderful bottles. Okay. All right. But y'all should already have the app because that's what y'all use to play NCLEX Jeopardy and Tease Tuesday, right? Right? Okay, that's what I thought. All right, guys. Hello. Welcome. Hey, Angie, Moni Mays, Saka J, Bonnie, Keeping Up with Sunny. Hey, boo, hey, Forever, Nika, what's up? Depends on when you place the order for your pen. Oh man, so we might be sold out. That's crazy if we already are. Hello, Miss Pam, Kansas City. All right. Hello, everybody. It's your girl, Nurse Sam. What's up? Future ER nurses. See you, boo. It is Nurse Sam here. Hello. I am a licensed practical nurse, LPN. Very proud and loud. Have been so for about 8 years. This year would actually make 8. Yeah. This year makes 8 years. And we are doing NCLEX Jeopardy. All right, if you guys do not know me, my page, or what I do, I help nursing students, RN and LPN, all nursing students, okay? Even though I'm an LPN proud, I help everybody accomplish their goals, okay? But yes, I help nursing students, all nursing students, thrive and survive in nursing school and pass their NCLEX so they can go ahead and become amazing nurses, like the amazing nurses that I know y'all are gonna be. Period. Okay. I also help aspiring and pre-nursing students. So if anybody's taking like their prereqs or taking studying for their entrance exam, which is like the ATITs or the HESI, I also help you guys as well. Tuesdays are your day. All right, for help in Tease Tuesday Jeopardy. But Thursdays is for all my peoples that's already in nursing school, about to start nursing school. You've already been accepted, or you've already started whatever semester. It doesn't matter what semester you're in, NCLEX Jeopardy can and will help you, okay? I cannot tell you guys how many messages I get on a weekly, daily basis of people saying, oh my gosh, I just passed XYZ test. I just passed my NCLEX PN, NCLEX RN, and your study bundles as well as your weekly NCLEX Jeopardy really help me. I can't tell you how many, okay? So, like I just said, we do these weekly, all right? NCLEX Jeopardy, that's our fun Jeopardy style review game. We do it for about an hour every Thursday. We spend that time together, okay? We're all just like a family, all right? This is you guys are my study buddies, all right? And I hope I'm your study buddy, period. Okay, so we come together and we basically this is like your group tutor, your free group tutoring for the week. All right. Our categories usually change, but it's usually the same. I won't say the same categories, but you usually get the gist. The categories will they will vary slightly, especially with the pharmacology and dosage calculations. I'll sometimes go between the two if I don't combine them all in categories. But just so you guys can see what we're working with, just in case it's your first time here, because I know I got a lot of new followers recently, so I just want to welcome everyone here, especially if it's your first time. Welcome to NCLEX Jeopardy Thursdays, okay? So I'm just going to show you guys what we're working with. All right, so when I say NCLEX Jeopardy, this is literally what I mean. Hold on one second. It's literally Jeopardy, all right? Literally Jeopardy. All right. These are our categories for today: pharmacology, peds, mental health, fundamentals, and adult health med surg. All right. Every category we have questions ranging from 100 points to 500 points. All right. So that is our NCLEX Jeopardy, especially that we're going to be playing today. All right. If anybody wants to play the same questions or just kind of play NCLEX Jeopardy, that's why you guys have the app, remember. If you go to NCLEX Prep, you'll see the NCLEX Jeopardy mobile version. You can play the same blue screen questions. You can play 25 new questions every week. I give you guys 25 questions every week for NCLEX and 20 new questions every week for T's if you're a pre-nursing student. Obviously we play for prizes. All right. A little let's not. Give me a thumbs up if y'all can see me and hear me, because I don't have time for the connectivity issues and my phone dying. Okay. All right, just make sure y'all can see me. Okay, cool. All right, so the app is called the Nurse Sam. It's literally the Nurse Sam app. All right, you'll see it if you search the Nurse Sam, 2 apps will come up. One's for the study bar community, and you get enrolled in. Well, if you sign up for it, if you become a member for $29.99 a month, you'll get that. You'll be able to access everything through that app. That's the study bar community. Now, the Nurse Sam app, all right, that's with the white background. It has literally the words Nurse Sam in it, black and gold. That's your free app. That's what you can use to view all our study kits, purchase any study kits that you would like, merch as well. But it's also where you get to play the mobile versions of NCLEX Jeopardy and Tease Tuesday. All right. So like I said, every week we update the questions. However, these questions that we're about to play right now, they have not been uploaded into the app because obviously we're playing for prizes. So I don't want y'all to see the answers before we actually get it. So after we get through, after we have our session, that's when I update the questions so you guys can play the questions, because we don't go over all 25 questions, because not only do we just answer them, we really go by a detailed step-by-step rationale. If it's a math question, I'm gonna show y'all exactly how I'll walk y'all through it. If it's obviously not a math question and like a rationale question, we go through the rationale. We come up with easy ways to remember it just in case. And it's really a group effort. That's why I really love the whole group tutoring aspect, because like I said, I know for me, with me being diagnosed ADHD a month ago, which makes a lot of sense, staying focused and really retaining a lot of the material would have been hard for me if I had it like in actual like nursing school. But I know for me on a daily basis, like that's part of the reason why I came up with the study gummies, because I needed like a natural way for me to keep, concentrated and keep focused and lessen my anxiety. So the study gummies were the perfect alternative to like the Adderalls and whatever's of the world. It's vegan, not a lot of sugar, and I just needed something that was going to help my focus and my concentration. So that definitely will help you if you find out that you're not suffering from ADHD, but having difficulty like concentrating, retaining information, and recalling information. Now, with that diagnosis, it made sense to me, because I know for me, I cannot retain anything if it's boring. If it's boring, I'm not interested in it. It's not sticking. Respiratory and GI. But, that's just some examples of the content topics that just did not work for me. No matter what I did, I literally had to make it fun. So I wanted to incorporate like a fun gamification style review game for you guys, hence NCLEX Jeopardy. All right. Now, every Thursday we do play for prizes just to help with like incentive and to help you guys like as far as like really wanting to learn and feeling incentivized when you get the questions right and everything like that, because we all know what can happen when you get the questions wrong. You know, that embarrassment, all that, possibly failing. But what I want and what I wish we did in nursing school a little bit more of is really, you know, celebrating the correct answers, celebrating the things you did right. Because so often, more than not, especially in the beginning, you're going to mess up a lot. All right. This is practice. Practice will make perfect, but you're not going to be perfect from the get-go. And that can be really, that you can get really down. When you're, you know, find yourself taking a bunch of practice questions and you're getting like majority of them incorrect. You know, I just did the post about the negative self-talk. You know, you'd be like, oh my God, I'm so stupid. How could I, you know, miss that question? And that has lasting effects. Okay. You may think you only do it in nursing school when there's a test, but what I found for me that it followed me through into the actual workplace. You know, I would, get something wrong, mind you, wouldn't be like it obviously wouldn't be a question because I'm actually in the work field, but I would you know, miss something that, you know, in my mind I feel like I should have caught, or I should have gotten right in the first place, and it would really make me feel down and I would like ruin my day. So I really wanted to, you know, create an environment and a community where, you know, we're all gentle with each other. We're gentle with ourselves as far as our learning. Okay. We're going to be learning for a very long time, period. And even after nursing school, you're going to continuously learn. This NCLEX Jeopardy is even helpful if you are already a nurse. Maybe you're transitioning into maybe from LPN to RN, from your ADN to BSN. Doesn't really matter. You're transitioning to another in a higher degree or higher credential. So you're always going to be learning. So this is a great refresher if you're already a nurse. If you're studying for your NCLEX, or if it's literally your first day of your first semester, this is definitely going to help. You're going to see these questions at some point, at some point. So that's exactly why I wanted to bring this, guys, bring this to you guys. Hold on, let me see what you guys are saying. Hey, boo, hey. I just want to give you guys some time to come in. Yes. All right. So a couple of house rules, because I see somebody asking how we answer the question. So you answer the question right here in the comments. All right. So what's going to happen is I'm going to tell you guys the category, how much we're playing for, and then I'm going to read the question and the answer choices. All the answer choices are either fill in the blank or multiple choice. I believe this game is all multiple choice. And so the answer is going to be either 1, 2, 3, or 4. Those are going to be the actual like answer choices. Now, because this is Jeopardy style, for you to answer and actually be correct and, you know, be up for the points, you have to say what is. So you have to actually answer it in Jeopardy style. So if I said, what is the gender of Rihanna's baby? I don't know. You know, you guys would be like, what is, and then whatever the gender is. I don't know. Nobody knows, I feel like. But you would definitely say what is, and then put whatever answer. You don't have to write out whatever the whole answer is, because I'm going to let you know this now. We have some people, they are quick with it, okay? So my advice is to copy and paste what is, and then you insert your answer, 1, 2, 3, or 4. So if it's, let's say we have an answer or question, and the answer is the second option, 2. Your answer in the correct format would have to be, what is 2? All right. And if you're the first person on my screen to answer that correctly, then you get the points. Now, I already told you guys that I kind of give everybody their flowers as long as they're answering. Because we're playing for incentive and prizes, obviously we got to go by our point system, whoever wins first. But you guys know, and I hope you know, I'm going to say it now. As long as you guys are answering the questions correctly, you're winning. You're learning, you're winning. Okay, so the what is just, is just so because we're playing Jeopardy style. It's for, motivation and to actually make it fun. But on the actual NCLEX, you don't have to worry about putting what is. As long as you get that answer correct, that's what we're focused on. Okay, I want you to make sure you guys understand the reasoning and the content behind why the certain answers and the questions. And if you get a question wrong, do not beat yourself up. It is okay. Yeah. Listen, I make these, and sometimes I'm looking at what is that answer, and I'll get it wrong because I'm either second guessing it or I read too fast. We're all human, but that's why we're here to practice so that on the actual NCLEX we're not making those little silly mistakes. Okay, here with me, you can make those silly mistakes all the time because we're going to correct them, right? We're going to correct them so that when you get to the actual testing center and your actual test, whether it's the NCLEX or your next exam on whatever, you're fine. You actually understand the content and you actually comprehend what you're being asked, okay? So let me look and see what y'all saying. Hold on. Yep, Jeopardy is free. A, the app is free. B, the 25 questions every week, the NCLEX Jeopardy, that's free. Tease Tuesday, which is also on the app, just in the Tease review section, free. All right, so I'm giving you guys free 25 free questions about the NCLEX every week, whether we do Instagram Live or not. Only time when we don't do is when I'm sick. Even on vacation, she's here, okay? I was in Savannah a couple weeks ago, and where was I? With y'all. Lit, but with y'all. Okay, so it is my duty and my goal to make sure y'all get as much practice as possible before whatever exam. So that's why we're here. Let me just make sure y'all don't have no questions. Hold on one second. Yay, you passed your boards, Forever Desiree. Awesome job. Yee. Awesome. All right, so let's go ahead and get started. And let's go ahead and start with pharmacology for 200 points. Let's start pharmacology for 200 points. Once again, I'm going to read the answer choices, or I'm going to read the question, the answer choices, and then you guys are going to answer what is, and then whatever the answer is. All right? So if you guys are ready, give me a thumbs up, and we will go ahead and get started with pharmacology for 200. Thumbs up if you guys are ready to play NCLEX Jeopardy. NCLEX Jeopardy. Give me a thumbs up. All right. Let me see what y'all are saying. Lauren, listen, he's so silly. Okay, so I'm getting some thumbs up, letting me know we are ready to go. All right. If you have any friends, nursing student, cohort people in your study group or whatever that may benefit from a fun review, make sure you tag them so they can join in as well. All right, so let's go ahead and get started. All right, so this is pharmacology. Go ahead and put your what is back in the comments. I understand. Put your what is back in the little in the comment section. Now I'm about to ask the question now. My bad. I messed y'all answer choices up. My bad. All right, so a client with chronic kidney disease is receiving epoetin alpha for the past 2 months. What should the nurse determine is an indicator that this therapy is effective? Is it 1, a decrease in blood pressure? Is it 2, an increase in white blood cells? Is it 3, an increase in serum hematocrit? Or is it 4, a decrease in serum creatinine levels? I'm going to read that one more again. A client with kidney disease is receiving, epoetin alpha for the past 2 months. What should the nurse determine is an indicator that this therapy is effective? 1, a decrease in blood pressure. 2, an increase in white blood cells. 3, an increase in serum hematocrit. Or 4, a decrease in serum creatinine levels. What is our answer? Make sure you put what is, or if you want to be considered for the points. If you're just really concerned about getting the answer correct, have at it. All right, let's see what your answers are, and let's see what the correct answer is. Drum roll, please. That was a sucky drum roll, Sam. Okay, it is, what is 3? An increase in serum hematocrit. That is the answer. What is 3? An increase in serum hematocrit. All right, let's look and see who got it first. Wait for it. Wait for it. What is 3? Maybe, is it Mabe or maybe? I'm not sure. Maybe 1103. All right, you are the first person on my screen. I can only go by my screen. I need to drink a water or something. But it is, what is 3? All right, so Mabe 1103, you got it. You are on the scoreboard with 200 points. All right, so Mabe 1103, you have 200 points. All right, I'm gonna go ahead and give my flowers to everybody that got it correct, whether you were first or not. But remember, like I said, as long as you get it correct and you understand why, you're really winning. Okay, so awesome job, Mabe 1103. Who else got it? PhD in Scrubs, great job. Anti But I Choice. NC Pink Rose. Maju. Remember to say what is. Daria. Who else? That's Mag 90. Brandon B563. I got you, boo. What else? Redbone 1538. Lauren. I cannot with you. Mabe, awesome. I'm gonna say Mabe. Yeah, you're not that late, boo. I was explaining a lot. All right, so yes, what is 3? Great job to everyone that said what is 3. It's an increase in serum hematocrit. So let's go ahead and go why. Because I see a lot of you chose what is 4 or what is 2. We're gonna go over why those are incorrect. All right, so remember, the question is asking, I'm gonna read the question one more time. A client with chronic kidney disease is receiving epoetin alpha and has been for the past 2 months. All right, so the question is asking us, how would we determine, or what would be the indicator that would help us determine that this therapy, aka the epoetin alpha, has been or is effective? All right, so we're trying to figure out if the function and the goal of this medication is actually what we're seeing. What would be an indicator in this patient that would let us know that the epoetin alpha is doing its job? All right, so first things first, what is epoetin alpha? All right, remember, this is pharmacology for 200. What the hell is epoetin alpha, okay? Epoetin alpha, that stimulates red blood cell production. All right, it stimulates red blood cell production. All right, now the initial effects should be seen within 1 to 2 weeks. Remember, they've been taking this for the past 2 months, okay? So initial effects should be seen within 1 to 2 weeks as far as that red blood cell being produced. But like I said, they've been taking it for the past 2 months. And then it says, and the hematocrit reaches normal levels in 2 to 3 months. Okay, so we would be giving this drug if give me an example. Can anybody give me an example of why we would give a patient epoetin alpha? If its function in the purpose of this medication is to stimulate red blood cell production, what kind of patient would you expect to be given this? Now, I know I said chronic kidney disease, but that's not right. But what would you expect to see in a patient that we're initially giving this to? All right, if we're given epoetin alpha and its purpose is to stimulate red blood, thank you, just being me, anemic. All right, if the purpose is to stimulate red blood cells so that they're made, then you can expect that we're giving it into somebody that does not have a sufficient amount of red blood cells, aka anemia. Okay, that's just an example. All right, so yes, anemic. So with this patient, they have the chronic kidney disease. I feel like that that chronic kidney disease was thrown in there to help y'all, to confuse y'all, especially because number 4 said a decrease in serum creatinine. That part really wasn't important. It's the purpose of the epoine alpha that's actually important. All right. So if we're going to stimulate red blood cell production, we can actually, this client, you can actually just kind of figure that they did not have sufficient red blood cells, or if they were anemic prior to receiving this. Remember, they've been getting it for the past 2 months. So we would expect to see that thing rise. If it's working, red blood cell production should rise. Now, as far as the serum hematocrit, can anybody tell me what the hematocrit is? I know you guys were looking for the red blood cells, but remember, red blood cells, hematocrit, hemoglobin, they kind of all go together, all right? The hematocrit is the, like the ratio, is the proportion of, let me say the actual correct words, all right? It's the measures the proportion of red blood cells in your blood, all right? That's hematocrit. It's usually in like a percentage, and it's usually like to a 1-to-3 ratio of whatever your hemoglobin is, all right? Dehydration, blood volume. Yes, low blood volume, basically, exactly. So, yeah, I would say anemia. I would think about like someone that's like maybe bleeding out, or there's just, but that's literally anemia. All right. So once again, the hematocrit measures the proportion of red blood cells in your blood. So if you already have red blood cells in your blood, you can expect for the hematocrit to be low. But if your red blood cells are increasing, you can expect for that hematocrit to increase. Remember, the concentration is that's what the hematocrit is measuring. So if your red blood cell goes up, then the concentration will go up. All right. I kind of think of it as far as like concentration. You know how you have like juicy juice, and it's like, oh, from no concentrate, and then you have like the juice that has however much percent concentrate, and that's like super super sweet, obviously. So I kind of like think of it in those terms. The ones with like no concentrate, as far as like hematocrit, in concentration, the juice with no concentration is not as thick and it's not as sweet, but the ones with concentrate, ooh, that thing is sugary because it has a high concentration of sugar and all that other stuff, not necessarily whole fruit juice. All right. So once again, great job. Let's go ahead and go to the next question. Let's do boop, 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 boop. Let's do adult health for 400. Adult health for 400. Remember to put what is. All right, so this says, after hypophycectomy, a client complains of being thirsty and having to urinate frequently. What is the initial nursing action? 1, increase fluid intake. 2, document the complaints. 3, assess for urinary glucose. Or 4, assess for urine-specific gravity. I'm going to run that back, okay? After hypophycectomy, all right? So hypophycectomy. A client complains of being thirsty and having to urinate frequently. What is the initial nursing action? All right. Is it 1, increase fluid intake, like I need to do because I've just been coughing. I need some water. 2, document the complaints. 3, assess for urinary glucose. Or 4, assess urine-specific gravity. What is our answer? What is our answer? First of all, okay. All right, I'm not gonna say nothing. I'm gonna let y'all answer. Y'all need me to reread it again? All right, so I'm looking at what y'all saying. This was a good one. All right, so I'm gonna read it one more time. After hypophycectomy, not a hypovasectomy, hypophycectomy, Phy-sectomy, all right? A client complains of being thirsty and having to urinate frequently. What is the initial nursing action? 1, increase fluid intake. 2, document the complaints. 3, assess for urinary glucose. Or 4, assess urine-specific gravity. All right, so the answer is, what is 4, assess urine-specific gravity? The answer is, what is 4, assess urine-specific gravity? Let me look and see. When I looked, I think I only saw like one person put that answer. No, I saw, no. NC Pink Rose was the first person to get it. And then second person to get it was Angie Green, 46. Awesome job. All right, so yes, the answer is, what is 4, everybody? What is 4? All right, so hypophycectomy. I'm going to go over the rationale. Hypophycectomy. What is that? Removal of what? Surgical removal of, yes, ma'am. What is it? Surgical removal of the pituitary gland. All right, so keep that in mind. All right, the question's saying, after, we can go ahead and when you have words like that and you don't want to get tripped up, just replace it with what the actual meaning is. All right, so after surgical removal of the pituitary gland, client is complaining of being thirsty and having to urinate frequently. All right, so the rationale says, after surgical removal of pituitary gland, diabetes insipidus can occur temporarily because of the anti-diuretic hormone deficiency. All right, so remember, we are surgically manipulating and removing the pituitary gland. The pituitary gland is like the hormone master, okay? Whether you have anterior or posterior, hormone master, all right? Now, this in particular, as far as like trying to figure out which hormone could possibly be like affected, you want to listen to the client's complaints, all right? They're complaining of being thirsty and having to urinate frequently, all right? When you think about hormones and increased thirst and increased urinary frequency, you want to think about the anti-diuretic hormone being affected, ADH. That can, let the name help you. Anti-diuretic. Remember, diuretic, well, never mind. Anyway, this deficiency, like I said, is caused because of the surgical manipulation. All right. Now, in order to kind of assess for that situation, you need to, to see if it's the ADH or the anti-diuretic hormone being the cause of this sudden increase in thirst and urinary frequency. The nurse should assess the specific gravity of the urine and notify the primary healthcare provider if the result is lower than 1.005. All right. Now, although increasing fluid intake and documenting the complaints may be components of the plan of care, I mean, obviously you can document that thing. But remember, the question is asking, what is the initial, all right, the initial nursing discussion. You remember this from Nurse Mike, Lauren? The ADH, oh my gosh. Hold on. Hold that thought. But yes, although increasing fluid, like I said, and documenting the complaints will be a part of the actual plan of care, it's asking you for the initial nursing action. All right. So those are not initial nursing actions. Those will just definitely need to be done before you get off your shift. Okay. And then it says, additionally, the PHCP, primary healthcare provider, will prescribe increased fluids. And then assessing for urinary glucose is unrelated to the client's condition. What people probably thought as far as being thirsty and having to urinate frequently, some people probably thought about like the 3 Ps of diabetes, frequent urination, frequent polydipsia, polyphagia, and polyuria. So peeing a lot, drinking a lot, Peeing a lot, drinking a lot. What's the third one? I literally just said it. 3 P's. I told you I'm ADHD, so my fleeting thoughts. 3 P's. Polydipsia, polyuria, and polyphagia. Okay, so eating a lot. There we go. All right, so that's probably what you guys thought because it was 2 out of 3 of the P's. Thank you, eating. Thank you so much. Eating a lot. But remember, the hypophysectomy is really the thing that kind of distinguished everything from, okay, what could it possibly be? The diabetes, it is a form of diabetes, but the diabetes that would come from pituitary manipulation would be diabetes insipidus, primarily because of the Adh hormone. All right, anti-diuretic. Now, if the anti-diuretic hormone is not working, you can expect to have those complaints. Peeing a lot, drinking a lot. So you can definitely expect to see those if that's being manipulated. All right. So remember the surgical word. This is med surg kind. Somebody asked, what are we doing? This is NCLEX Jeopardy. We are playing a Jeopardy review game for all things NCLEX. Right now we are on med surg / adult health for 400 points, and NC Pink Rose got that question first. So we're about to go on to our next question. All right. Question. This is a question because I definitely remember seeing this. If not on my endocrine test, definitely on my NCLEX, and I had to really figure out if I knew how to comprehend the information. All right, so right here it says that the initial nursing action would be to assess urine specific gravity. All right, and report it to the provider if it's lower than 1.05. So would you expect that urine to be concentrated or very diluted? If we have a deficiency in Adh hormone or anti-diuretic hormone, if we do not have enough of that anti-diuretic hormone, would you expect the urine to be concentrated or diluted? Look at what y'all are saying. Absolutely diluted. Ooh, I'm so proud of y'all for all saying the correct answer. Absolutely. The urine specific gravity is actually going to be low. All right. And if that urine specific gravity is low, aka that 1.005 or less, all right, you can expect a urine osmolality of less than, specifically less than 200 whatever MOSM per kilograms, milliosmolytes, whatever. You can expect that urine osmolality to also be decreased. All right, and that is the hallmark sign of diabetes insipidus. Now, one way for me to remember, all right, is DI for diabetes insipidus. Think about diluted. All right, does that make sense? So DI. The DI in diluted also stands for diabetes insipidus, okay? You can expect for that urine to be very diluted, all right? It's going to be very, it's not going to be like very yellow at all. It's going to be really more so water content that you're excreting out as opposed to the waste, all right? It's like the waste and everything else that really makes the urine smell bad. But if you just think about having like this much urine, okay, for like a regular size urine, all right, if your ADH is actually working fine, your urine's going to be normal. It's going to be normal concentration. It's going to be yellow, all right? Now, if you add this much water, all right, into your urine, you can expect for this to be very diluted. The concentration is actually going to lessen, all right? And that's exactly what you would get with, yes, urea. That's exactly what you would get with diabetes insipidus, all right? Does that make sense? So yes, so diabetes insipidus, expect for the urine to be diluted. Diabetes insipidus, diluted. Okay? All right, next question. Let's do peds. Let's do peds for 500. Let's do peds for 500. Oh, good question, Shasha. When would the urine be concentrated? Y'all tell me. Give me an example of when you expect for urine to be very, very concentrated. Oh, Ashaya, I'm so proud of you. Dehydration, absolutely. All right, so with diabetes insipidus, in order for it to be very diluted, you have lots of water going on, all right? For the opposite, aka dehydration, you don't have any of that water. So expect for that urine to be concentrated, stank, and very, very yellow, okay? Awesome. Ooh, my dog. Girl, I'm about to give you 200 points for that because that was a good one. That was a good one. And you just came out there with it. Yes, ma'am. All right. So I'm sorry, but Ashaya just got 200 points because that was good. Proud of you. Proud of you. See, that is comprehension. All right. All right. So next question. Let's go ahead and go back to our Jeopardy. Awesome job, guys. I'm grasping some notes, period. All right, so NC Pink Rose said SIDH, which is syndrome of inappropriate ADH. That's also a really good one. That is when the body makes too much ADH. All right, so if you have anti-diuretic hormone, you're going to, if you have a syndrome of inappropriate anti-diuretic hormone, your body's going to retain lots of water as opposed to excreting it out. All right. Let's go back to see. All right, let's go back to our question for this is peds for 500. I kept saying symptom, it's syndrome. All right, so peds for 500. The nurse is reviewing the record of a child diagnosed with nephrotic syndrome. All right, the nurse should expect, aka future y'all, the nurse should expect to know which finding documented in the child's record. I'm going to repeat that one more time. The nurse is reviewing the record of a child diagnosed with nephrotic syndrome. Nephrotic syndrome. Write that down. The nurse should expect to note which finding documented in the child's record. 1, polyuria. 2, weight gain. 3, hypotension. Or 4, grossly bloody urine. What is that answer? You have a child who's diagnosed with nephrotic syndrome. All right, we're looking in that chart, knowing what nephrotic syndrome is. What should we as the nurse expect to see? Which findings should we expect to see documented in that child's chart since they have nephrotic syndrome? Is it 1, polyuria, 2, weight gain, 3, hypotension, or 4, grossly bloody urine? What is that answer? My hands are cold. What is that answer? I'm gonna scroll back. I'm gonna scroll all the way up. Scroll all the way back up. All right, so that answer is Shasha said it's either 1 or 4. You gotta pick one. You have got to pick one. All right, so the answer is, drumroll please, what is 2 weight gain? What is 2 weight gain? All right, the answer is what is 2 weight gain? All right, let me see the first person to get that. Hold on one second. Junie June. Hey, Junie June. Okay, now. All right, so Junie June, you are on the scoreboard and in first place with 500 points. That's the name of the game. Anybody can come in and get those 500 pointers correct and just swoop up the game, okay? That's what Junie June did with that 500 point answer. Congratulations, love. Great job. All right, so everybody else that got what is 2. Anti-But-I Choice. Who else? Benta Kib, Teddy Burlove, Jamie Maldonado. I think I said that. Everyone said, what? No, we're going to go over it. I promise. All right. So nephrotic syndrome. All right. Remember, there's certain diseases and certain, disorders that have, characteristic findings or, like hallmark symptoms. So a lot of times when you get, especially when you get into med surg and basically peds too, whenever you get a lot of these disorders and diseases that come up, a lot of the questions will ask you for the hallmark sign. Like, what is it about this disease that makes it almost stand out from all the other ones? All right. So when you see this finding, and you see this word, or you see this disease, you instantly think about this finding or whatever hallmark sign. For example, polycystic ovaries. I don't know if you guys have had this one yet, but before I even knew what it was, because I have it, before I knew what it was, I know that the hallmark sign and symptom of PCOS is a string of pearls in the ovary. All right, that is a hallmark sign. All right, that's like definitely going to be what's going to differentiate it from all the other differential diagnoses. All right. So with this child being diagnosed with nephrotic syndrome, one of the most characteristic findings of nephrotic syndrome is that dramatic weight gain. All right, that dramatic weight gain. That is what you know is going to be there. This isn't saying that the other stuff can't be present, but the question is asking, you should expect to know what, just from knowing that they have nephrotic syndrome, without knowing any other type of history. From the fact that they have nephrotic syndrome, what can you expect to see? And the answer is weight gain. All right, that massive edema is gonna result in that dramatic weight gain. All right, and that is a characteristic finding in nephrotic syndrome. It says urine is going to be dark, foamy, and frothy. But only microscopic hematuria is present. All right. So number 4 is a grossly bloody urine. It wouldn't be grossly bloody. It would be, there's only a microscopic level of blood in that urine that's going to be present. But that urine is going to be dark. It is going to be foamy and frothy. It's like a dark urine cappuccino. Ew, that was nasty, Sam. But that frank bleeding does not occur. With that nephrotic syndrome, urine output is going to be decreased. So it would not be polyuria. They would not be urinating frequently. They would actually be urinating less. All right. And then, so that's number 1. That's why number 1's out. And then number 3, that said hypotension, you would actually likely be, I'm sorry. I'm so sorry. Y'all know I'm a visual person. But that blood pressure is actually most likely to be increased, not decreased. And you can kind of remember that with how I remember, like, whether or not, like, fluids and the relationship between fluids and blood pressure. If someone has a lot of fluid built up, for example, a child with, or somebody with nephrotic syndrome, a child with nephrotic syndrome, they have massive edema. So they're holding on to a lot of fluid, which is, once again, going to result in that weight gain, all that fluid. Now, if you have a lot of fluid in your body, you're actually going to expect for that blood pressure to be high. Okay, so just think about it. All that fluid basically is going to increase the I'll just say increase the blood pressure. Okay, if you are dehydrated and you don't have a lot of fluid in you or running through your veins, you can expect for that blood pressure to actually be decreased. All right. I think about it like a water park. All right. The more fluids you have, the more water you have in that water park, the faster the kids are gonna go. The kids are gonna go in the tube slide. All right. But if you don't have a lot of water, then that slide is gonna be not that much fun. It's gonna be slow. And the water that's going in the actual water tube is going to be less, so it's going to go slower. That's kind of how I think about it, as far as like whether or not you have a lot of water or a little bit of water in your body and how that affects blood pressure. Okay, I think about the vessel itself, and I think about the vessel being like a water slide. More water, the faster everything's gonna go. The faster everything's gonna go through that blood vessel. Stop doing this. The faster everything goes through that blood vessel, the higher blood pressure goes. The less water, right, like plaque buildup, the less water you have, the less tension, hypertension, the less tension on that blood vessel or on that water slide. So it's gonna go slower. It's gonna be less, if that makes sense. All right. So once again, nephrotic syndrome. When you think about nephrotic syndrome, think about massive edema. They're swollen. All right. So how can we relate? So how can we relate nephrotic syndrome to just being super swole? I'd probably just say that. Nephrotic syndrome, the S for syndrome stands for swole. Okay, cool. That's how I do it. Listen, this is literally how I did my study groups. Okay, first of all, me and my study group was lit and fun. We ordered pizza. We played these types of games. Listen, it was all night. It was fun. We all passed, period. Okay? All right, next question. Let's do, we've done farm, peds, adult health. We haven't do mental health or fundamentals. So let's do, let's do mental health. Let's do mental health. Like a dialysis patient? Yeah, actually. Pretty much. Yep, pretty much. Okay, let's do mental health, and let's do this one also for 500. Let's just go ahead and let's do it. A hospitalized client experiencing delusions reports to the nurse, aka you. I know that the doctor is talking to the top man in the mob to get rid of me. A hospitalized client experiencing delusions, all right, reports to the nurse, just comes up to you and say, look, I know Dr. Gray is talking to the head and the top man of the mob, and y'all are out to get me. What response should the nurse, aka you, make to this client? 1, I don't believe this is true. 2, the doctor is not talking to the mob. 3, do you feel afraid that people are trying to hurt you? Question mark. Or 4, what makes you think the doctor wants to get rid of you? Question mark. Lauren said, well, that'll do it. I'm out. Listen, at least he didn't say you're talking to the mob, because listen, I don't know if y'all had y'all mental health rotations, but boy. All right, I'm going to repeat that one more again. All right, we have a hospitalized client that's experiencing delusions. We already know that they're going to be saying some things that are not happening. They're experiencing active delusions. All right, and they're about to come up to you and give you a perfect example of one of them delusions. Okay, look, I know that the doctor is talking to the top man of the mob, and y'all are trying to get me, or they're trying to get rid of me. So what should be your response as a nurse to this client? All right. The answer is, what is 3? Do you feel afraid that people are trying to hurt you? Question mark? That is the answer. Okay. I don't know why I say. I wanted to put question mark because I was trying to ask it in a way to let y'all know, to make y'all know that it is a question, especially because y'all can't see the answer choices. But I just wanted to really confirm that yes, it was the last 2 were questions. So the answer once again is, what is 3? Do you feel afraid that people are trying to hurt you? Let me go back and see who's the first one to say what is 3. Mabe 1103. All right, but you're already on the score road with 200 points. You just got another 500 added, so now you have 700. Awesome job. All right, who else got what is 3? The Goddess. Smile 16. What's up, boo? Hey, Lauren, I see you, boo. What is 3? Payroll Fresh. Amen. Listen, Payroll Fresh. Vince Kib. Dufaseni, C. Trinice, Olada Latonia, Jamie Maldonado, Jamie Mall. I'm gonna say that. Poor patient just thinks they listen. They think it's coming. I take mental health May 9th. Have a patient hide on the tables and y'all think people were coming if he was in a ward. Listen, sometimes that happens. But as the nurse, you got to know how to therapeutically communicate with this patient. All right. So the answer once again is, what is 3? This is the rationale. It said, when delusional, a client truly believes what he or she thinks is real to be real. All right. The client's thinking often reflects feelings of great fear and aloneness. So it is most therapeutic for the nurse to emphasize what the client's experiencing, or emphasize what the client's experience. Disagreeing with the illusions may make the client more defensive. Like, there's no mob coming. I'm telling you, there's a mob coming, and then this might be your face. You don't want to do that, all right? It's going to make them more defensive, which could make them more agitated. Just don't do it, all right? Because they're going to cling to that reality because it's a delusion. What they're saying is what they really believe to be real. It's not our job to tell them, nope, absolutely not. The sky is not blue. The sky is not orange. It's not. If someone's having a delusion, they tell you that the sky is orange, you're just not going to disagree. Okay, you're not going to disagree. You're just not. You're going to therapeutically communicate. And the best way, when I did mental health, what I noticed after taking so many practice problems and really reading the book from front to, not the book, but the mental health chapter from beginning to end, because mental health was difficult for me. What I realized that the pattern was that you rephrase it in a question. All right, you're trying to therapeutically communicate. You want to bring them back to reality without negating what they're saying. What you're going to do is kind of like put them in a position so that they can talk to you. All right, they're going to talk to you about it. So this one says, do you feel afraid that people are trying to hurt you? Rephrase it, all right? Really take what they're, like we said, the delusion often reflects like a feeling of fear. So you're going to point that out and then ask that in a question form, all right? Once again, the delusion is, I know that the doctor is talking to the top man in the mob and they're out to get rid of me. So therapeutically and in a question form, you'll be like, this one says, do you feel afraid that people are trying to hurt you? And then usually they'll go on and this is them being able to talk to you, all right? To get to the real root of why they're afraid or why they're saying that the doctor is trying to get rid of me, all right? All right, so get rid of me, that happens to be what you're really focused on. So let's talk about that. But you're not saying, let's talk about that, because they're in a delusion. So the best way and the most therapeutic way for you to do it is to rephrase it so that they can talk to you, all right? It says encouraging discussion. What did I just say? Encouraging discussion regarding the delusions. Well, let me not say that. You don't want them. Okay, number 4 says, what makes you think that the doctor wants to get rid of you? That's actually encouraging the delusion. All right, you don't want to encourage it because you know it's a delusion, but you just want to ask them about why they think what they're thinking and why they feel the way they feel. So 4 would be encouraging the actual delusion, which is inappropriate. And then 1 and 2 are you just straight out, flat out disagreeing with the delusion, which is also inappropriate. So 3 would be the only therapeutic way to actually, you're not disagreeing or agreeing, you're just asking them a question. Okay? Yes. Leave the question open for them. You want to leave it open. You want to ask the question so that they can interpret it and answer your question in their own way without, once again, encouraging it. 4 was wrong because it says, what makes you think that the doctor wants to get rid of you? That's not necessarily getting them to express how they feel about being rid of, whatever. But 3 says, do you feel afraid that people are trying to hurt you? Do you see what the difference is? 1 is getting them to talk about how they feel, like the roots of it. Delusion aside, they're really afraid of people trying to get rid of them. Not necessarily anything about the mob. That part is just a filler, okay? So that's why 4 is encouraging it. What makes you think that the doctor? So they're gonna go back and say, well, this they had on white and I heard them talking into a microphone. That's giving them more ammo and giving them Oprah opportunity to just further themselves in the delusion. I know it can kind of get like tricky when it comes to mental health, but the more you actually do these therapeutic response and therapeutic communication problems, I promise you you will start to recognize a trend. All right, you will start to recognize that there is definitely a certain way that you answer these types of questions. Teddy said, but what if the doctor comes after us for reasoning with the patient? He's so stupid. Someone said, that's funny. If it's a doctor you don't like, but like, I think they're coming for you too. Don't do that. Don't do that. All right, so let's next question. All right, this one's going to be fundamentals. Fundamentals. Ooh, this one's good. For 300. The nurse is explaining to a client what electroencephalography. There we go, I said it. Electroencephalography. I can't say EEG. Damn, the EEG. All right, the nurse is explaining to a client what electroencephalography, all right, involves in EEG. Y'all know what I mean. Damn. What response by the client indicates that further teaching is needed? I just wanted to show y'all that word because it was not coming out. All right, so EEG, electroencephalography. All right. What response will a client indicates that further teaching is needed? 1, this test is minimally invasive. 2, there is no risk of electrical shock. 3, it can help diagnose and treat my seizures. Or 4, electrodes are placed on specific areas of my scalp. We're explaining to a client what an EEG involves, electroencephalography. What response by the client indicates that further teaching is needed? 1, the test is minimally invasive. 2, there is no risk of electronic shock. 3, it can help diagnose and treat my seizures. Or 4, electrodes are placed on specific areas of my scalp. Remember to say what is, remember to say what is. All right, the answer is, Ooh, this question got y'all. What is 1? The question is, what is 1? The test is minimally invasive. The test is minimally invasive. That is the answer. All right, remember, I'm going to go back to the question. It says, what response by the client indicates that further teaching is needed? So we're looking for the wrong answer. All right, so the answer is 1. The test is minimally invasive. That's not true. It's not true. An EEG is actually just non-invasive. It's actually not invasive at all. All right, it's sticky tabs. There's nothing, nope, it's nothing invasive at all about an EEG. It's an EKG, but for your head. Honestly, that's what it is. All right, so just like an EKG is not invasive at all, so is an EEG. It's just to your scalp. Now, what they will do with an EEG is take that wig off. I'm sorry. So if you got a lace front, if you got some tracks in your head, it's coming out. That is the only thing. that is the only thing. All right. So tracks and your weave, they're out. I'm so sorry, but they are out. They are out of here. And I can tell you this from personal experience. All right. I had one in high school, and I just got my hair done. Love. I had just got my hair done. That nurse took them scissors and just it's like she was a pro. Like she knew how to take out some tracks. I don't even know. She was, but she just went. And she just gave me my bundles right in a nice little bag. Honey bun, here you go. Here you go. All right. But an EEG is actually not invasive. All right. Non-invasive. So it's not minimally invasive. It's non-invasive, just period. All right. Now, as far as 2, 3, and 4, those are actual facts about EEG. EEG, is there no risk of electrical shock? That's true. That's a true statement. 3, it can help diagnose and treat my seizures. Absolutely, that is true. That is true. And then 4 is electrodes are placed on specific areas of my scalp. It's true. It's little stickers. It's the stickers, and they're placed on specific areas of your scalp. Just like with an EKG, they're placed on specific areas of your chest and, well, your body. Some of them goes in your arms and stuff like that. So, 2, 3, and 4 are actually correct options. And the question's asking, which response indicates further teaching is needed? So whenever, little tip, whenever you guys see a question and it ends in, which response lets us know that the client that further teaching is needed, that means you're looking for the wrong answer. All right. Now, sometimes it can get us tripped up, and that's why NCLEX does it. It can get us tripped up because it's asking us to look for and identify the incorrect statement or the incorrect answer. And just by default, whenever we're taking a test, we're looking for the correct answer. So a lot of times when we're taking like the NCLEX or whatever exam, and we come across a question like this where it's asking us to find the negative answer or the incorrect answer, as we're going through the answer choices, somewhere in our brain it switches back, and it's like we forget to say, okay, I'm looking for the wrong answer, and we just go ahead and when we read one that's actually true, we'll be like, oh, that one, and we just forget. So what I had to do and literally train myself to do every time, because I know how my brain is, it will switch right back to looking for the correct answer in a heartbeat. Okay, so what I do is each answer choice I have, I'm asking myself, is this wrong or is this correct? Like, is this false? Is this true or false? Is this wrong or is this right? Like, which answer, if it's asking us for the wrong answer, every answer choice that I have, I'm reading it. So, for example, number 1, this test is minimally invasive. Is that true or false? Is that true or false? I have to ask myself that. It is false. So I know that's a false answer. This is asking me to look for a false answer. So that could possibly be it. I'm going to put a star right here. 2, there is no risk of electrical shock. Is that true or false? That's true. But that's not what the question is asking. My question is asking me to find a wrong answer. And if 2 is true, then that can't be the answer. I have to literally train my brain, okay? So, I do the same thing with 3 and 4. 2, 3, and 4 happens to be all true answers, but that's not what the question's asking. It's not what it's looking for. We're looking for the wrong answer, all right? 1 is wrong, all right? It's not minimally invasive. It's not invasive at all. It's not invasive in its entirety, okay? So that is why 1 is correct, because it's incorrect, and that's what the question's asking. Does that make sense? Does that make sense? Nurse Sam, can you make a post on tips to answering multiple choice questions and choosing the answer? Multiple choice or multiple select? Because I have a multiple select post coming up. But let me know what you mean, Aisha Love. Multiple choice, like 1, 2, 3, 4, or multiple select, aka select all apply. SATA. I add an N next to that because it's Satan questions. Absolutely. All right, so let me know what you mean specifically. But everybody else, does that make sense? Questions like these, absolutely. All right, so the first person that got this one, hold on, let me go back to it because I don't think I gave you your points. 1 second. Wait for it. Wait for it. PhD in Scrubs. All right, PhD in Scrubs. PhD in Scrubs. All right, you got 300 points added for yours for that answer. Who else got what is 1? Let me like that. Mabe 1103. Okay, Mabe 1103. Listen, you have been on it tonight. Who else? Ola Delatonia. Awesome job. Yeah. So everybody else kind of got 2, 3, or 4, but I just went over why, and I also went through why you probably got that wrong. So don't beat yourself up. Do not beat yourself up. Okay. Like I said, sometimes a lot of people really, even though they'll understand, oh, my response for the what response for the client indicates further teaching is needed, they'll be like, I'm looking for the wrong answer. And by the time they get on that second one, or maybe even the first one, they're already looking for the true answer or the correct answer. So it's just really a mindset thing. It's a practice thing. I'm gonna make a post about how to answer questions like this, and also just put it on paper, like my tips and tricks on how you don't get confused when you're taking questions like this. Okay. Awesome. Look at what y'all are saying. Oh, both. All right. So I'm gonna make a post as well about answering multiple choice questions and multiple select all apply. I know we're gonna have a special training about select all apply. If you guys have not joined the study bar community, please do so, because a lot of those trainings will be held in the study bar community. All right. So if you like this group teaching setting, just like we do every Tuesday and Thursday, definitely join the study bar community, because that's literally what basically it is, just with more content and more specific content. So every week we do our NCLEX Jeopardy and Tease Tuesdays, but if you still want to do the group tutoring and the group studying, but with more specific context and topics, like if you want to do this about endocrine, if you want to do this regarding how to answer select all apply, those are going to be done in the study bar community. So I highly recommend that you join. It's still only $29.99 a month. And you get access to all future events that we have coming up, as well as the NCLEX Arcade full. You get to download it, download the workbook, and watch all 6 videos that are like 3 hours long. But remember, after the end of the day, tomorrow, you won't be able to get NCLEX Arcade other than signing up and joining the study bar community. Oh, I love when I explain the rationale. Thank you. It'd be funny to me. I tripped on that one. That's okay. That is okay. I love to, whenever we do these study groups, I love to compare it to, y'all know I love my Beyonce. Listen, Beyonce down, okay? And a great thing that I like to compare it to is when she had the homecoming. You remember that homecoming special on Netflix from when she was at Coachella? I love to compare it to that, all right? In her documentary, she said that they practiced for like a year straight. And if y'all think that first month or the first couple weeks, y'all, she was looking like how she did on the actual Coachella. She wasn't. She was messing up too. So if Beyonce can mess up, why can't you? Why can't you? Practice makes perfect. Practice is going to be ugly at first, all right? You're not going to get all the dance moves right off bat. You're just not. But with practice, you're going to be all that good stuff. But you have to practice, all right? It comes with practice. And with me and Study Bar Community, we make practicing fun, okay? Perfect. Okay, cool. So if you guys want to, let me announce my winner. My winner is, with 700 points, Mabe 1103. So congratulations, boo. You ended the game with a total of 700 points. So congratulations, Mabe 1103. So please send me a DM with your full name and your email address. And do you have the Ultimate Nursing School bundle? If not, you just want it. Yay. If you do have the bundle already, let me know if you don't have the NCLEX Arcade workbook or the Critical Care Study Kit, because those aren't included in the Ultimate bundle, and you actually will get that. So you do have the Ultimate. Do you have the NCLEX Arcade workbook? If you don't have the NCLEX Arcade workbook, you win that. All right, that's 372 pages, and that's over 200 questions, I believe, of NCLEX. Boom, there you go. All right, so send me your email address, send me your full name, and I will send over the NCLEX Arcade workbook right to you. All right, like I said, it's 372 pages. And over 200 questions, and that's basically how we do like our NCLEX Jeopardy, but it's arcade theme, it's arcade style. So instead of cardio, you got super cardio, like Super Mario, but it's cardio. It's so cute. So congratulations. A lot of people are just now coming in. Hey y'all, hey. We are at the end of NCLEX Jeopardy. That is our super fun group study review, study group / review for NCLEX nursing school, both RN and LPN. We just went through about 5 questions, and I'm going to put the rest on the app. Okay, so actually let me go ahead. So if you guys want to finish off these questions, like I said, there's literally 20 more questions that I want you guys to do. It's 25 questions every week. Like I said, practice makes perfect. Y'all, please practice with these questions every week. Is your free review, okay? I'm going to put this on the app. So if you downloaded the app earlier today or just before, remember to go to, and the app is the Nurse Sam. That's literally the Nurse Sam app. And you can go ahead and play the questions that we didn't get to play. Yeah, right here. All right. So once again, the categories: farm, peds, mental health, fundamentals, adult health. Especially in mental health, I want y'all to go through those mental health questions and just note how similar, or just note the answers and note the correct responses, especially when they're asking about therapeutic communication. Take those and just note the trend and note the what they have in common as far as how you would answer them. All right. Let me go ahead and update that now so that when we get off of this, y'all can play it. If it's still showing after we get off, if it's still showing the questions from last week, then you will just most likely have to just quit the app. I don't know if y'all have iPhone, but y'all know how to quit it, like scroll up and quit the app, whatever, and then reopen it and it'll have the new questions. Hold on, somebody said, where can we print the NCLEX Arcade work? You can print, I recommend if y'all have printing to do, I recommend printme1.com. It's literally, hold on, let me just type it here, printme1.com. Boop. Wait, did I do it? Hold on, let me pin it. There you go. Printme1.com. That is how you print out. That's where I recommend that you print out whatever you need to print out, especially the Ultimate Nursing School Bundle, and the ATITs, really whatever digital study kit that you want. But I also used it to print my NCLEX Arcade. Don't worry about this. But yeah, so I printed it with Print Me One right here. That's how thick it is. It is 372 pages. All right, you have your questions here. All right, you have your questions. You have your notes section, so if you just want to take notes. And then it also has like whatever the artwork for whatever topic you're in, or whatever chapter you're in. And then at the end of that chapter, you get the answers and the rationale. All right, so it'll tell you we'll tell you, especially with Select All That Apply. This is great practice for Select All That Apply. It'll show you what's correct, why it's correct, what's wrong, and why it's wrong. So it has the rationale built into it already. And this is just the workbook. If you want the full arcade, you'll get the 6 videos as well. Each video is 3 hours long. We had these are replays from our 6-day NCLEX Arcade that we had about a year ago, literally a year ago. And we teamed up with Mike from Simple Nursing to create this. And I put the replay up, and you guys have been loving it. It is a great resource for anybody that's either just starting nursing school, because I always say the best time to start preparing for NCLEX is your first day of the first semester. You might as well just get into it now so you can prepare for it a little bit at a time, so you're not scrambling at the end of your nursing school program. All right, so you're learning how to answer your exam questions, your regular chapter exam questions, but you're also preparing yourself for how to answer those NCLEX Arcade questions. And I don't know about y'all, but before I took my NCLEX and before I graduated, I had to do an I had to do an ATI predictor test. So it was basically NCLEX, but through ATI, and that gave you like a percentage, like how likely you were to actually pass the NCLEX. And we literally could not graduate until we got a certain score. We passed that TEAS the ATI predictor. And I'm telling y'all this now. To even prepare yourself for that, I recommend starting yourself off early as possible, as far as preparing yourself for the NCLEX, learning how to do the NCLEX questions. All right, whether that's Bentikip said you have to do that for Kaplan next month. Now, whatever it is, that's whatever your, like, whether it's ATI or Kaplan, use the resource that's giving you the test. So I had to use the ATI, and I used my ATI books. I don't know if y'all can see them right here. I used my ATI books for my ATI predictor. Now, if I had Kaplan, I think Kaplan has its own like study test. Since they're the ones giving the test, use their material to study. All right, because they're asking you the questions. And I know with ATI especially, it's like they have their own language. It's their own language. Like, I don't know what it is. But that's why I say for that, definitely use your ATI books if you're doing ATI. If you're having Kaplan, use Kaplan. But for the NCLEX, that's pretty much whether you're taking RN or PN. A lot of people use UWorld. A lot of people use Saunders. I personally didn't use those because I'm a visual learner. And I'm sorry, but 8 years ago, UWorld was boring as hell for me. I fell asleep each and every time. I'm sure it's better now, but that's just not what I use. A lot of people use UWorld now. Go for it if that's you and that's your judge. But for me, absolutely not. It was too boring. So that's another reason why I created NCLEX Arcade, because I needed something that I was going to be able to stay awake in. Like I said, if it's boring, if it does not interest me, I will fall asleep. I will fall asleep. I cannot do it. So I literally had to make NCLEX Arcade. So if that's something that you're interested in, join the Study Bar community. You get it for free. and it's included. Or if you just want to just get it on your own, download it, go ahead and get it from our website. Somebody said I use, hold on. See, I failed using it and it's boring. It's so boring. I'm sorry, I can't. Unapologetically, stop it. That's funny. But yes, I just need to, I need to have fun when I'm studying. I'm sorry. Entertaining, when you're entertaining somebody, or if you're entertaining yourself, whatever you're learning, you retain it. And that's exactly why. You know how like mamas be like, you need to learn your homework like you learn the words to them songs. Well, if homework was as fun as me singing Drake, then I would remember it more, Mom. And it's actually true. It's true. So I actually use that. And I would, in nursing school, I would often like remix popular songs to whatever I'm learning in nursing school. And it would be so silly to the point where I cannot escape my brain. There's still some things that I remember from high school that it was so dumb or just so funny that it just burned into my brain. And that's how we do it over here. Happy studying and fun studying. Lauren said it's still boring. 8 years later, it is still boring. That's funny. Awesome. That is so funny. Oh, I love y'all. All right, guys. So I'm gonna let you guys go. Hold on, like the green light. Where can we get the replay? Replay. If you go to the link in my bio, or if you sign up for the Study Bar community, it's all there. But if you aren't a part of the Study Bar community and you want the video replay, then go to the link in my bio where it says the 6-day replay for the comprehensive NCLEX Arcade. You can still get it that way. If you just want the workbook, then that's on my website as well. But the Nurse Sam website. Go to the link in my bio so it can take you to the link to buy the actual full thing, because it's like a course. What else? So for this one, okay, so for the ultimate bundle, that's 400 pages. This is 372. So for this, I think I paid like between $60 to $80. And yeah, between $60 to $80. I can't remember, because I also have a 10% off coupon as well. But I know to print the 400-page one in color, have it, bind it or bound, whatever, and deliver it to you, with my code, it's $85 for the actual Ultimate Nursing School bundle. That same exact PDF, that same exact bundle cost $200 plus at Office Depot. I don't know why they playing in your faces, but I'm not here for it. I'm not going to stand for it, okay? So that's why I wanted to make sure I recommend the most cost-effective printing company that I know, that I personally use. Mind you, I am not an employee of theirs. I don't get money or coins every time y'all use it. I don't get nothing. Okay, it's just a wonderful recommendation, because like I said, I want to make sure y'all get everything y'all need to be successful in nursing school. Okay, it's everything I do isn't always a profit. Like I make these things to make your lives much easier and to make nursing school as less of a panic attack as possible, because like I said, I've been there before. And I didn't have anybody to have my back or to really provide me with these answers or anything that I needed. So if you want to print it professionally, then I recommend Print Me One. It is the most cost-effective site that I know of. And like I said, I've literally gone and paid my own money to all these different places to test out quality, and to test out, shipping times and everything like that. I wasted a little grip of money. But printme1.com, love it. Love it, love it, love it. We'll always recommend it to you guys, because if y'all want to print it out, I want you to be able to print it out. Now, when you get this, when you get the digital version, a lot of people are asking me, does it expire? Absolutely not. It is not. It does not expire. Now, for the Ultimate Nursing School bundle, that has already been updated to the point where I can't update it no more. So we have to start part 2, okay? Same thing will apply with the part 2 of the Ultimate Nursing School bundle. After we get to a certain page, all other updates to it will be included. ATIT's bundle, we're going to be updating that from ATIT 6 to ATIT 7. Information will stay the same because anatomy is going to be anatomy, whether it's ATIT 4 or ATIT 7. That stuff's not going to change. The format is changing, so I'm going to be updating that. Now, everybody with the ATIT's bundle, all updates to that will be complimentary for free. You'll get the email with the new link when I update it closer to June, because everything's going to be switching over to the ATIT 7 come June 3rd. All right, so if you have the ATIT's bundle, all updates will be complimentary. So I highly suggest you get that if you are studying for your T's and need that. 40% off if you use code EGG40. Same thing with NCLEX Arcade. If y'all want to buy NCLEX Arcade, whether the workbook or the full thing, it's 40% off until Sunday if you use code EGG40. Okay, so once again, go to the link in my bio, or go to my stories to just go to access the link directly. And if you want to purchase it, use EGG40. Do not purchase it at full price. I'm warning you now. Do not purchase it at full price, because we have a 40% off coupon that you can just use, and you can save that coin to get drinks, get something else. I don't know. Respond to one of these Fashion Nova texts that they keep sending us. I don't know who's behind their marketing, but A1. But yeah, I want you guys to A, save your money, and B, feel comfortable and confident when you go into whatever exam, whatever nursing program that you have, because I love you long time. Okay? All right, let me see if y'all have any more questions. So see, look, I bought it yesterday. Do these links expire? Absolutely not. Absolutely not. Absolutely not. No, ma'am. You buy it once, you're good. That's why I really love digital. Okay, because if I had it physical, then you would write up all up in it. You wouldn't be able to use it. But with anything digital, A, you can print it out however many times you want. B, you can download it to your phone, your computer, your husband's computer, whatever. Keep it in house. Keep it to you. Don't send it to your homegirl down the street, because they gotta purchase it too. It is one link per person. Do not share links. But yes, it is. You can re-download it as many times as you want. You can print it out as many times as you want, and the links do not expire. Any type of update that I have, whether it's to some of the study kits that are in there, because I will be updating the study kits. I will let you guys know, and I will send you guys an email with literally the updated information. So there will be no repurchasing if y'all don't have to. Listen, I don't want y'all to waste y'all money on me on anything. Okay. All right. Oh yeah, and just in case some people choose to, share the link, especially in the Facebook groups, people tell on y'all all the time. My followers will tell on you, okay? And then you will be blocked. So don't do that. Just don't do it. Just don't do it. And if you, pirate it and you don't get it from purchasing, you won't get any of the updates. You won't get any of the updates. So make sure you are either coming to NCLEX Jeopardy Tuesday to literally win these free things. Like, we literally have giveaways every week. If you come in and just try for NCLEX Jeopardy, just try for ATIT's Jeopardy on Tuesdays, get first place. Or sometimes I do 3 winners. Sometimes I'm like, everybody on my scoreboard will win free stuff. I'm here to make sure you guys succeed. Okay? So, anyway, if y'all have no other question, I will see y'all next time. What's tomorrow? Friday? Yep, I'll be making an announcement tomorrow about what we're going to be talking about in the study bar community. So make sure you guys tune in for that, and hit me up if y'all have any questions. All right, have a great week.